Hi guys, in this part we want to learn about the skeletal system. A skeletal system is a framework in our body that contain bones, cartilages and ligaments. Bone function is body function, protection, movement, mineral storage and hematopoiesis. We have 200 named bone in our body that divided two groups. One of them is axial skeleton that contain the skeleton that is in the skull, vertebral column and rib cage. Vertebral column, rib cage and skeleton, the skull. Another part named appendicular skeleton. Appendicular skeleton is bones that include upper limb and lower limb. All of the bone that there are in the upper limb and lower limb named in this category, appendicular skeleton. We have terms about the bones. When we want to read a bone, we have a rough part or another part like a groove in the bones. That it is necessary we learn about this term about the bones, like foramen, that means opening. Fossa means shallow depression. Sulcus means groove. Meatus means tube-like passageway or canal. Condyle, that is large and round protuberance. Facet is a smooth, flat, articular surface. Trochanter is very large projection. And tuberosity is a large and rounded projection. This is some of the terms. You'll learn another terms when you are reading anatomy. All of the bones in our body divided long bone, short bone, and irregular. Here you can see long bone. Long bone has these parts: two epiphyses in the two ends of the bones and one diaphysis in middle of the bone. Now about the bones that we have in the upper limb. In this part we want to learn about the upper limb bones, muscles, and other structures that we have in the upper limb. First, about the skeletal system in the upper limb. In the upper limb we have this part: shoulder, arm or brachium, forearm or antebrachium, carpus and metacarpus, and digits. These three parts, carpus, metacarpus and digit, named hand. So shoulder, arm, forearm and hands. These are parts of the upper limb. First, about the shoulder. In the shoulder we have two bones that named clavicle in the anterior and scapula in the posterior. Clavicle and scapula. Shoulder is junction between the trunk and arm. So here named shoulder girdle. These two bones make shoulder girdle. Another part is arm. In the arm or antebrachium we have only one bone that named humerus. And in the forearm or antebrachium, we have two bones, one in the medial that name ulna, and another in the lateral that name radius. Ulna, radius. And here that we name hand or manus has three parts. First, carpus, another name of the wrist. In the carpus we have 8 bones that located in 2 rows. Each row has 4 bones. So here we have 8 bones. Another part named metacarpal. Metacarpal 1, 2, 3, 4, and 5. Here we have 5 bones. In metacarpus we have 5 bones from 1 to 5. Another part of the hand named digits. Each digit has 3 parts: proximal, middle, and distal. Proximal, middle, and distal. But thumb has 2 parts: proximal and distal. Name of the digits from lateral to the medial in anatomical position is the first, second, third, fourth, and fifth. Name of the second is thumb or pollicis. Second is index. Third, named middle finger. And fourth, named ring finger. And fifth, named little finger or digiti minimi. Little finger or digiti minimi. Clavicle. Clavicle is a long bone that located horizontally in our body. It is one bone that located horizontally in our body. And in the medial articulate with the sternum, and in the lateral articulate with the scapula. So these bones, as you can see in this picture, has 2 surfaces, superior and inferior. Superior and inferior. Has 2 ends. 2 ends. This end and this end. This end is lateral end and the other is medial end. Because of the medial end articulate with the manubrium of the sternum, so named sternal end. You learn sternal end is medial end. And here acromial end because articulate with the acromion process of the scapula, so named acromial end. Look at this picture. Here you can find this curvature. This bone is not straight. This bone has 2 curvature. One of these curvature is convex. Look at here, from medial end in here till here, convex. And the other is concave, from lateral here. So concave is 1/3 of the bone and convex is 2/3 of the bone. So in the anatomical position of the clavicle we can find 2 curvature. convex 2/3 of the bone from the medial end or sternal end, and convex 1/3 of the bone from the acromial end or from the lateral end. Here, between this point that's convex and concave reach to each other, here we have weak point. We have weak point. Here is the most fracture of the clavicle bone. This point is the most fracture of the clavicle bone. But clavicle has most fracture in all of the skeletal body, because it is the anterior from the all of the skeleton that we have, from the all of bones that we have in our body. So here you have attachment of the muscles that we want to learn in the myology, not here, because confuse yourself if you want to learn here. Look at the inferior surface. In the inferior surface you find this roof part of the bones, here and here. I told you here that we have two joints. One of them in the medial between sternum and clavicle, and here between scapula and clavicle. So because of this, that we have in all of the joint we have ligaments, so here you can find traces or footprint of the ligament in this bone. This is footprint of the ligament, because in this end and this end we have joint. This is traces or footprint of the ligament. And look at here, that name trapezoid line and conoid tubercle. Trapezoid line and conoid tubercle. And this is between the ribs and clavicle. So in this inferior surface here you can find this groove. When a person is alive, in this groove we have a muscle. Name of the muscle is subclavius. Subclavius is between the clavicle and the first rib. Between the clavicle and the first rib. So after a person is dead, so here that we have muscle, it is a soft tissue. So this destroyed soft tissue. We have traces of this muscle. We have footprint of this muscle that make this shape, that are named subclavian grooves, because here we have subclavian muscle. So till here you learn all of the structure that we have in the bone. Maybe it is traces of the ligament or muscle or another things that named vessels and nerves. So all of these three, muscles, ligaments, and vessels and nerves, make traces or footprint in all of the bone that they are adjacent of this bone. So I repeat for clavicle that we have two end, two surface, two curvature, and two border. This is border, this line is border. This line is border. But here is surface, because surface located between two border. You can see here surface, here surface, and sides of this surface you can find border. So we have two border, anterior and posterior border. So all of the things in this bone is two border, two surface, two end, two curvature, and one weak point here. Please, you write for me how you can recognize and how you can say this is left clavicle or right clavicle. If you look at here right clavicle. If give you a bone that is clavicle, how you can distinguish this is right or left clavicle? Please write and send by Navid for me. Scapula. Scapula is a flat bone. You can see here. This is like triangular. This is triangular form. This is anterior view and this is posterior view of the scapula. So here in the anterior view, you can find this fossa that named subscapular fossa. This fossa covered by a muscle that named subscapular muscle. So here you can find this roof part that show us here we have bones, and these traces show us this is traces of the muscle that located here, and this is posterior surface. In the posterior surface you find this spine. This is spine named scapular spine. This is scapular spine. This spine divides the scapula two parts. One fossa in the superior, another in the inferior. Superior named supraspinous or supraspinatus fossa. Supra because it is superior. Spine, it is superior of the spine. Supraspinous fossa. And here it is infra. So you can tell this is infraspinous fossa. In the supraspinous and in the infraspinous fossa, we have two muscles like this name. Supraspinatus muscle or supraspinous muscle, and here infraspinous or infraspinatus muscle. These two fossa are covered by the muscle that is like their name. So you learn in the scapula we have two fossa, anterior subscapular. In the posterior we have two fossa, supraspinous and infraspinous. In these bones you can find three angles: superior, inferior, and lateral angle. Superior, inferior, and lateral angle. Lateral angle is not like an angle. Change this form and change to the like a facet that articulate with the humerus. So this facet, that is a round facet, named glenoid cavity or glenoid fossa. So you learn that lateral angle change to the glenoid cavity. And you learn about the inferior angle. It is in front of the seventh rib. If you want to find the seventh rib, you find the scapula. After this you find the inferior angle, and you say it is just front of the seventh rib. So this named it is landmark, because according to this landmark we can find 7th rib. In the scapula, we have 3 processes. Coracoid process, in this border, coracoid process, and this is coracoid process here, and acromion process. This is the spine of a scapula, continuous of the spine of a scapula, named acromion process. That I told to you, this part articulate with the lateral end of the scapula. And another process in this spine, coracoid, and acromion process. Here in this view, you can find coracoid process and acromion. We have 3 borders in these bones: superior, lateral, and medial. Glenoid cavity is a landmark you find. Here is a lateral border because glenoid cavity articulated with the humerus bone. So this is lateral border and this is medial border. So I repeat, in the scapula we have 2 views, anterior and posterior. In the anterior view you have only one surface, that you have this surface that has that named subscapular fossa, and in the posterior you have 2 fossas, superior and inferior of the spine, that named supraspinatus and infraspinatus fossa. You have 3 borders that named superior, lateral, and medial. Superior is the shorter and keen, and you have 3 processes: coracoid, acromion, and spine. Look at here. This is superior border. In the superior border here, this is coracoid. Near the coracoid and the lateral end of the superior border, you find this part. This named suprascapular notch. Suprascapular notch. This bone is in a dead person, but when a person is alive, suprascapular notch named suprascapular foramen. Notch is in the bone, but foramen is a live person. Here we have ligament. This ligament is transverse ligament, so named scapular transverse ligament. Scapular transverse ligament change this notch to a foramen. Change this notch to a foramen. So you have here, and this change to the foramen. One structure passes from this foramen. That name of this structure is suprascapular nerve. So suprascapular nerve passes from the suprascapular foramen. Please, you write to me which structure passes over the suprascapular ligament, transverse ligament. We have ligament here in the alive person, and 2 structure passes over this ligament. Please rewrite for me name of these 2 structure. And you write for me how you can explain situation of the clavicle and the scapula. You learned about the anatomical position, about the anterior, posterior, and another terms of the in introduction. If you want situation of the clavicle and scapula, you write what about this? Please write for me about this.